Welcome back to the Global Business Report on the Rise News. That is, of course, Governor Babajide Sanwo-Olu of Lagos State in the Lausa in Ikeja talking about, giving us an update on COVID-19, Delta variant, third wave. Let's take a listen.
And the number of daily confirmed cases of COVID-19 in Lagos State, with a positivity rate that was going from about 1.5% at the end of June 2021, we saw a growth to about 7% at the end of July 2021. In fact, between the first and the second, yesterday in particular, we've seen a growth of about 9%. So this has shown that we've seen about 8-fold increase over the recorded figure a month ago. And it should rightly alarm all of us. This had resulted in about 4,300 confirmed cases nationally in July alone, and we've seen about 355 admission in our isolation center within the month of July alone. But I think it's important to let me assure you and make it clear that the necessary sense of alarm should not be responded with a panic, but instead we should resolve and we should be more determined to reverse the trend. We have done it before, and I believe we can do it again. We dealt with the first and the second wave, and we did our best indeed to prevent this third wave. Now that it's fully upon us, we must dig deep with what we have learned from the first and the second wave. And as we summon the will to do everything necessary to bring down the numbers on the way to eventually defeating the virus once again by all of us. So we have some epidemiology updates. And so from the beginning of February 2020 to date, Lagos State has recorded over 64,000 confirmed cases of COVID-19. Of this number, over 56,000 have recovered in the community. Over 2,700 are still currently being managed in various communities. And in the course of managing COVID-19, we have seen, unfortunately, about 319 fatality in Lagos, and over 5,000 have also been admitted at our various isolation centers in Lagos. Of that fatality, we've seen about 30 that has happened within the beginning of this third wave. Essentially, we have recorded an average of 6 deaths per day in the last 1 week. Regarding our home care-based strategy, so given the huge population of our state and the rising numbers of COVID confirmed cases within the first and the second wave, it has become necessary for us to deploy our telemedicine, which we used in managing our positive patients. And in the same vein, we have launched an home care-based program, which is driven by our Eco Telemed call center. This home care-based program had worked in delivering our care packs to our asymptomatic patients. We have thousands and thousands of care packs, which we procure during the second wave, over 150,000 care packs that we have in our possession. Those the ones that do not need admission for treatment, will have the home care packs that we can send to them, and is making our specialist care also available on our telephones. And if you have any symptoms, like we continue to say, that is associated with COVID-19, or that you think you have tested positive to the virus, we'll continue to encourage you to take advantage by reaching us on our Eco Telemed, which is a toll-free number, which is 08000 356 633, which is 08000 356 633, which we also call the 08000 EcoMed. I think it's important for us to mention where we are regarding the vaccine distribution and access strategy for vaccines. Following the receipt of the first installment of AstraZeneca vaccine from the federal government earlier in the year. Lagos State administered a total of 404,414 first doses, 404,414 for first doses, and a little over 243,000 for second doses to our residents at that time. So as of today, we would say that about 1% of our population have received the double dose of the AstraZeneca vaccines. This is quite low, especially considering that we now have confirmed cases of a third wave, and we're exploring all avenues to possibly ramp up access to vaccination so as to reach what we see as a global herd immunity of about 60% of the population. Experience from other regions of the world show that majority of the confirmed cases that have resulted in death were unvaccinated persons, meaning that what we've seen in other parts of the world, it's people that have not been vaccinated at all that leads to fatality. This is why we're seriously looking to scale up our vaccination coverage for our people, and also the kind of numbers and the kind of things that we're seeing even with our admission and our isolation centers in the past 3 weeks. I think it's gratifying to note that yesterday, 1st of August, Nigeria received 4 million doses of the Moderna vaccine. And I think it's been widely reported. We received 4 million doses yesterday. We're being told that the samples are currently being tested by NAFDAC. And we're expecting that Lagos being the epicenter, that will receive a sizable amount of this allocation once the testing, and that we believe will be completed before the end of this week once it's been completed. These vaccines cannot be mixed with the AstraZeneca vaccines. Let me repeat, for people that have taken the first dose of the AstraZeneca, they cannot mix it with the Moderna that has just been received now. But we're still expecting a second allocation of the AstraZeneca vaccine, and we've been assured that they should come before the end of this month. So we're monitoring that as well. So meaning that people that got the first vaccine, that the AstraZeneca, they should just wait for us to get the new set of AstraZeneca, right, and they'll be able to get their second dose. And so the dosage of Moderna will be people that will be taking, the very first doses of the Moderna vaccine. We will also ensure that all future vaccine administrations exercises are based solely on appointments, so that we can avoid a situation where the vaccine administration will turn into a super spreader. But I would also mention that part of our strategy was also still to look at all of our frontline health workers that has not been vaccinated. We believe a sizable number of them has been vaccinated during the first set, but if anybody has not, they will constitute the first set that will also be taken. And also family members of anybody that were found to be positive, anybody that has been tested positive, right, within this third wave, themselves and their family members, everybody or all contacts they have will also constitute, a first set of people that we believe should come forward and take, the Moderna vaccines once they have them, available. I think it's also important for us to talk about the travel protocols, especially for our inbound passengers. Between May 2020 to date, we've had over 72,000 international passengers that have arrived in Lagos via the Murtala Mohammed Airport. Of this over 72,000, about 18% of them were reached using the EcoTelemed, because they provided, of course, their telephone numbers and they provided their local contacts. We will continue to employ all our inbound passengers arriving into Lagos to endeavor to provide valid contacts details to the authorities so that they can all be properly monitored. To manage the third wave of this pandemic, the EcoTelemed will continue to focus on monitoring and tracking inbound passengers and cases in our various communities. We will also not hesitate to impose sanctions and penalties on all those who are caught violating the rules. I think it's important for us to mention the sanctions for people that have not complied with the quarantine rules that we have. So as directed by the Presidential Steering Committee, passengers that are coming from the red zone countries, there are countries that have been designated as red zones, which are India, South Africa, Brazil, and Turkey. They are required to observe what we call the mandatory isolation. So meaning that anybody traveling into the country from this, they are meant to have a mandatory 7-day isolation. So far, we've been able to successfully isolate over 5,178 passengers that have arrived into Lagos. And we believe about 12 to 30% must have absconded, given the total number of travelers that are coming. And so following the publication of names of abscondees by the Presidential Steering Committee, compliance to mandatory isolation protocols have certainly increased significantly. After we published the names of abscondees, we've seen a huge compliance from people coming in from this country. So it is also reprehensible to admonish people that will come from this place and do not want to self-isolate. I think it's something that is very reckless and they should not be encouraged at all. And if you are found, we will ensure that the full route of the law is on you. If you're a foreigner, they might withhold or they might revoke your residence permit. And if you're a Nigerian, you might also be prosecuted. And so Lagos will also be going after anybody that has come from any of these red zones and have not complied with all of the rules around mandatory isolation. We'll be going out, to ensure that we identify defaulters. For all non-travelers who have been diagnosed positive, isolation, we believe, is mandatory. Anyone caught breaching the isolation protocols will be subject to a host of sanctions and penalty, which of course might include, like I said, prosecution. I think it's also very important for us to mention at this junction that only state-accredited medical facilities can manage COVID-19 cases. There are state-accredited public health facilities, which are the isolation centers, at IDH, at Bagada. We're planning to see if we should open up the indoor isolation centers. We're checking our numbers, and we're trying to prepare that place. But we also have privately designated, hospitals that can also manage COVID cases. These are the ones that we believe have been accredited, and these are the ones that we hope that people will go into and get treated. It's important for us to also still mention our non-pharmaceutical interventions and protocols. I would like to implore all our primary, secondary, and tertiary educational institutions to cooperate with officials from the Ministry of Health and Ministry of Education to ensure that the safety of our people are taken very seriously. We know that there's a current influx of students who are here on summer vacation into the country, and we believe that they all need to be properly managed, because we believe if they're not managed, this could amplify, factors for the third wave that we're all talking about right now, which we're currently experiencing in the country. So we're talking to students that are coming from international travels. We're talking to students that are in our primary schools, secondary schools, and tertiary institutions. If you notice anything in any of your schools, please let's cooperate and work with the Ministry of Health and Ministry of Education, and let's see how we can help you, and we can send test officers into your various schools, and we can manage. People should not hide. If they notice or if they suspect anything happening in their various schools, please, they should speak up and they should speak out so that we can manage this third wave, very quickly and very decisively. We want to also re-emphasize that all our existing rules and guidelines around social and public gatherings are still in place and must be obeyed. I want to encourage all residents of Lagos to keep themselves familiar and updated with the restrictions guidelines as outlined by the state and federal authorities. In addition, the non-pharmaceutical interventions of mandatory face mask and physical distancing in public places, regular hand washing, and avoidance of non-essential movements must continue to be taken very, very seriously. Most importantly, and particularly, I would reiterate the need for everyone to wear their face mask. And I want to thank you, gentlemen of the press, here at this gathering for keeping in strict compliance with these protocols. We have an incontrovertible evidence that wearing of the face mask helps in slowing down, the spread and the spread of this third wave, particularly now that the third wave is more of a stronger strain than the first and the second wave. All establishments, offices, entertainment spots, commercial spaces, and religious houses are mandated to provide hand washing or sanitizing facilities and to ensure that persons are admitted only with their face mask. If you don't have a face mask, want to reiterate that you have the right to deny people access into your facility if they don't comply with the rules that have been set. Proprietors of public transportation services must also refrain from admitting non-compliant passengers into their vehicles. It is only by strictly adhering to these rules that we can indeed stand a chance at taming this third wave that we have with us now. Distinguished guests, gentlemen of the press, let me reiterate again. The third wave is already here with us. As much as we would have wished for a more positive outcome, we do not have a choice than to tackle it and to tackle it head on. We're no longer inexperienced as a people in dealing with the coronavirus pandemic. 18 months into the pandemic, we have learned a lot as a people, as a government, as a state. We have seen the progress and we've also noticed the setbacks. We have been able to refine our strategies and our response, and we're now in a good place to ensure that this third wave is the final one. I believe we can close the pandemic chapter very, very soon. But we all need all of us to work together on this. But we must put in the work, we must ensure the high level of compliance, and we must ensure that the rules and regulations are strictly adhered to going forward. Gentlemen of the press, thank you very much. I will now be open for a few questions or clarifications, if there are any. Thank you. Yeah.
Good afternoon, sir. Thank you, sir, for providing the insights and updates on issues around COVID in Lagos. Okay, my name is Babajide Sanwo-Olu, and I write for the Guardian newspaper. What you talked about the dose. There were information that some of those who received the first dose have not come back for the second dose. There are implications for that. They will probably be denying those who probably will have received the first and second dose. What is the state government doing about that? For those who have not come forward to receive the second dose. Two, you talked about experience from other clients in terms of how those who have died from COVID-19 were majorly those who did not receive the vaccine. What is the Lagos experience?
Thank you. Oh, there's a third. No, let him ask his clarification. Yes.
The third one has to do with, you said 13% of those, of the 72,000 passengers that came into Lagos has come there. And you also said that when the names of those who have responded were published, that there has been an improvement with people coming forward. I just want to get a clarification. 13%, was it after the published names or before the published names? If it's after the published, if it's before the published names, what is the present rate of absence?
All right, live press conference there in Alausa, in Ikeja, in Lagos, commercial capital of Nigeria. That's Lagos State Governor Babajide Sanwo-Olu, who's just given us an update on COVID-19. He says the third wave is here, and he's urging Lagosians to get vaccinated. About 4.4 million doses of the Moderna vaccine have just been received. We covered that on the with Arise business analyst Bode Oshoshimi. Moderna is jacking up their prices along with other makers. But key point here, 4.4 million vaccine doses of Moderna have been received. They will be administered shortly once testing has been concluded with NAFDAC. And the governor also said that, of course, that should not be mixed with the AstraZeneca vaccine. So if you've already gotten your first dose of the AstraZeneca vaccine, you're going to have to wait until a second batch of doses is received. It cannot be mixed with Moderna. The Moderna vaccine will, of course, be administered to folks who are yet to get any vaccines at all. So, of course, that, and now he's answering questions from the media.
We don't want to mix, we ask not to mix, doses. If you're on AstraZeneca, just wait and get your second dose of AstraZeneca. Regarding that. You talked about experience from other clients, if it is 99%, it's exactly what we've also noticed. The unfortunate case of mortality that we have seen in the last week, especially, are people that have not been vaccinated at all, right? And so that is also the same trend that we have noticed, at our own isolation center. Your third question is around the percentage of abscondees and what it is now. This was before the publications, and all of it. Now we've seen, a lot better compliance because at the entry point, our officers are a lot more stringent. The only thing, the appeal that we're continuing to make is that people should ensure that they give all the right, information, especially inward travelers. But people that are coming from the red zone, it is mandatory that they go into our isolation. And these are isolation places that were provided for them. These are hotels that were provided for them that they must, by compulsorily go and isolate, at those hotels. But for other travelers that are just coming in, is to ensure that they continue to give us, the correct data, and telephone numbers so that we can monitor them in the period of self-isolation, and we can be sure that even if they have any symptoms, we can, using EcoTelemed, they can pick it up and we can know what to do for them.